afternoon, everyone. My name is Alina Ramos, and for my presentation within my group, I chose to do oral thrush in adults. Now, the scientific name for oral thrush is oral candidiasis. It is a fungal infection commonly known amongst infants. It's not very common with adults or widely discussed, and that is why I chose this for my presentation. As I said before, it is a fungal infection. It is due to the presence of the Candida fungus, a type of yeast. The Candida albicans is the most commonly implicated organism in this condition. And as you can see on the side is a more detailed image of the inside of the organism. Get a better idea of it. Now, symptoms of oral thrush are lesions are creamy white. They appear on either your tongue, your roof of your mouth, the inner cheeks, on your gums or your tonsils. Very uncomfortable. There are cottage cheese-like lesions which cause a difficulty in eating, swallowing. There can be redness, soreness, and even a burning sensation in your mouth. As you can see on the image, you can see how thick it is, so you can know that it causes a loss of taste. Now, some more symptoms can be cracking or redness of the corners of your mouth, and oral thrush can be grouped in 3 different groups. Pseudomembranous, which is the mouth surfaces look white or creamy. Erythematous, the mouth looks red and raw. And lastly, hyperplastic, you'll have white plaque-like lesions or speckled red spots in your mouth. Now, who is at risk? On the top of the list are HIVs or AIDS patients. Now, this is due to their already weakened immune system, so it makes them more vulnerable to obtaining oral thrush. If you're diabetic and aren't treating or taking care of yourself properly, or you have excess sugar on your tongue, oral thrush can thrive on it. There are also certain medications such as prednisone, which is a drug used to treat arthritis, blood disorders, breathing problems, and severe allergies. In addition, if you have an inhaler. Also, who is at risk are people who have oral conditions such as wearing dentures, not properly cleaning them, especially your upper dentures, the use of inhalers, not cleaning them after each use. In addition, breastfeeding can affect both mother and child due to the excess milk can cause a fungal infection. Best preventable way to prevent this from happening would be the use of nursing pads to ensure that bras and all equipment always stay clean after every use. Alrighty, as you can see in figure 4, we get a look at the subjects and the percentage of being carriers for the fungal infection, not actually having the infection, but being carriers for the infection. And as I said before, HIV patients are the highest percentage group. As you can see on the side, they have approximately 95% of being a carrier for the fungal infection. We see neonates are only 45%, which is really high for a neonate. Healthy children are above healthy adults with 45 to 65%. 30 to 45% for the adults, because we see it more common in children rather than we do in adults. Also, you can see with denture wearers, they're 50 to 65%, so it's very important to ensure that they are properly cleaning their dentures so that they don't have to deal with thrush. Now, diagnosis. As you can see with the symptoms, it's pretty easy to self-diagnose due to the creamy lesions that thrush displays, also the high discomfort. Now, if you see it on your tongue and you're still not too sure about if it is thrush or if it is not thrush, you can always seek a medical professional, and they will be likely to diagnose it very quickly just by looking at the infected area. Now, if they are unsure and you're unsure, in rare cases, a test is needed in order to diagnose, and they can use a cotton test swab or an x-ray. Now, treatment for this would be antifungal medications, antifungal mouthwash, and a simple Listerine will work just as well. Lozenges, minoconazole, which comes in pill form. And above, these are all used for mild to severe cases and will typically improve from 7 to 14 days as long as you're continuing to do it regularly. Now, for extreme cases, there's flucazole, which also comes in pill form. Now, if the discomfort is really high, you could also try at-home remedies, which include salt with warm water, probiotics, water mixed with apple cider vinegar, hydrogen peroxide, lemon juice, or even baking soda. Now, preventive measures. It is always really good to maintain good oral hygiene by brushing and flossing at least twice a day. Now, if you have an inhaler, it's always important to ensure that you're rinsing out your mouth and always washing off your inhaler after each use. It is also important to regularly see your dentist. If you're a diabetic, continue to minimize your sugar intake, maintain your sugar, and also have a good look at your blood sugar levels. If you wear dentures, ensure they are clean and fit properly. If they do not fit properly, there's a chance that bacteria can get inside and a good chance of you getting thrush. Now, other information, fun facts. Thrush is common and is easy to treat when symptoms are mild. And they're also really simple and easy to notice on or around inside of your mouth. It's easier to treat them now when they're mild rather than wait for them to get severe and have to live with a lot of discomfort. Now, if you take into account to the preventable measures, you won't be liable for thrush. In addition, thrush can become present in different parts of the body. It could even cause vaginal yeast infections. But within this presentation, I only went over the oral aspects with thrush. Thank you so much, and below are all of my references from the Disease Control Center, Mayo Clinic, the Frontiers in Biologies, and WebMD. Thank you.